I used to say to people, there's some really good government websites you can go to get your questions answered. Unfortunately, the political layer, the political corruption of the agency is so extreme that unless you really have a lot of expertise, it's very hard to sort out what on their website is fact and what is absolute fiction and lies.
Today's guest is Dr. Rich Besser, President and CEO of the Robert Wood Johnson Foundation. RWJF is a leading national philanthropy dedicated to taking bold leaps to transform health in our lifetime. A member on the National Academy of Medicine, he serves on several boards, including Howard University's Board of Trustees. Previously, he had a distinguished career at the Center for Disease Control and Prevention and ABC News, and is a longtime advocate for healthy communities, accountable public health systems, and racial justice.
There are a lot of people who are working so incredibly hard and they're falling further and further behind. We need universal health care in America. We need to have a situation where no one is going to become bankrupt because they become ill and had to choose between paying for a drug and paying their mortgage or paying their rent.
Dr. Rich, thank you so much for taking the time out of your day to join me today.
Dr. Monty, it's great to be here. I'm really looking forward to the conversation.
Why I'm so excited about this is obviously you're leading, right now a huge philanthropical organization that I love connecting with, collaborating with. The work that y'all are doing is phenomenal. And then just your expertise, right? Obviously, you have been in the CDC, you do media with ABC News. You are an advocate for things that I also am an advocate for. And for me, this conversation is going to be so exciting because as a pediatrician, I'm always looking for ways to increase my advocacy and also educate our community on how to be better advocates. And so my first question to you is, what's notable about where we are today in terms of the education that's coming out there or the policies that are coming out there? And where do you wish parents kind of can understand where we're sitting at this intersection right now with eat better, eat healthier, but where there may be more of a divide here?
Yeah. Well, thank you for that question. Before I answer that question, I wanted to add a couple things to my identity.
I love it.
I am a dad. My wife and I raised two boys who are now adults, and I practiced general pediatrics for over 30 years. And with all these other jobs, I've always thought about myself as a pediatrician. And I've always tried to keep in mind the conversations that I would have with parents who were always trying to do the right thing for their kids in spite of systems and things in their lives that increasingly made that hard to do. Mm-hmm. And so the question about the current moment, I think about a conversation I might be having with a parent in this moment. I always worked in community clinics, something called federally qualified health centers, which provided support for lower income people in America, some without health insurance, some with Medicaid. And it was usually moms, sometimes dad, but usually moms I was talking to, they wanted to do the right thing. But they were faced with situations where doing the right thing might be more expensive than they had the dollars to do. Getting information about what the right thing is to do has become increasingly complicated. In my early days as a pediatrician, there weren't so many voices coming at you telling you, oh, you need to do this, you need to do that. What they say is wrong, what they say is right. It's a lot to handle. And so I think that the cost of just basic life is one of the big challenges right now. The way that information has become so politicized. It used to be that there was a set of facts. There was a set of things that we all kind of thought that we knew. Some of them weren't right, but at least we aligned behind them. And there might be disagreement about what you should do with those facts, but we weren't disagreeing about fundamental things like, are vaccines good for your health?
Mm-hmm.
Is it, is it good to eat meat or not eat meat? Is it? There were things that we kind of knew and we could talk about without them becoming so political and so hot. And right now, it feels like the world is divided up into these little camps,
Yeah.
and everyone's getting their information from the people they trust or the people who have access to them, and it's really hard to know what to do. So that's the context that we're in. That's so challenging.
I could not agree more. As I mentioned to you before we started recording, I never realized that I would be on social media in the space that I am right now, educating. And a lot of that reason I joined was little droplings of these sort of misinformation, nuggets that I was getting, whether it was about sleep, feeding, how to feed, don't feed your kid this, don't do this. And as I've been on social media, I've seen it even more because, of course, social media gives people platforms that may not or should not have those platforms, as me and you both know.
Yeah.
And one of the things that's being lost, and I think you can agree maybe to this from what you've seen in your career, is that there is some truth to some of the conversation. Like, I'm going to use the example of like red dye, right? Like, we see red dye. Do I want my kid eating everything with red dye, processed foods, all of that? Absolutely not. But is the occasional red vines, is the occasional drink that has, red dye. My daughter loves maraschino cherries. Like, she's obsessed with maraschino cherries, which has red dye. Is the occasional use of that going to lead my kid down a path of unhealth? And that is where I feel parents are feeling so overwhelmed because, like you said, everyone wants to do the right thing. And not only are things just more expensive, there's just so much more noise that's telling them, well, if you do that, your kid's going to have X, Y, and Z. If you do that, you're a bad parent. So there's this morality around food and around nutrition that's been created. So you mentioned it beautifully. Parents are getting advice from everywhere: social media, schools, doctors, friends, and it's not always the evidence or, based on the things that we used to know, which is, okay, here's what the science knows. Here's what we know by just experience. So how do you suggest parents sorting through that conflicting information about food and health, wherever it may be coming from?
Yeah, it's really hard, and I would say the advice I give people now is different than the advice that I was giving even five years ago. What I like to say to parents is, if you have the opportunity to have a relationship with a healthcare provider, a pediatrician, a family doctor, a nurse practitioner, that relationship can help you sort through this noise.
Yeah.
And that's really, really important. Unfortunately, we're seeing this administration taking that opportunity away from more and more people. Millions of people losing access through cuts to Medicaid. $1 trillion cuts over the next decade to Medicaid and SNAP. But if you have a healthcare provider, talk to them about it. If you feel that you can't ask your child's doctor or nurse a question about, is it okay to do this? Is eating a red vine gonna mean that their life has now gone off the edge? If you don't feel you can ask that question, then if you have the opportunity to look for someone else to be your child's provider, look for someone who you feel comfortable asking those questions to. I used to say to people, there's some really good government websites you can go to get your questions answered. I worked at the CDC for 13 years, and the CDC is still full of hardworking people who are committed to public service, who are committed to doing the right thing. Unfortunately, the political layer, the political corruption of the agency is so extreme that unless you really have a lot of expertise, it's very hard to sort out what on their website is fact and what is absolute fiction and lies. And so I don't steer people there anymore. The American Academy of Pediatrics has some good sites and good information if you want some more detail. But I would start with the person that you are trusting to help take care of your child.
And it's so interesting, Dr. Besser, is that I was in that space, the 12 years of outpatient pediatrics. I know you did 20 years of outpatient pediatrics. And when I went into pediatrics, when I was a high school student, medical student, and I had my mentors in healthcare, I looked at how they communicated the time that they had, and I was like, this is going to be what it is for me. I'm going to be able to be that foundation, teach the families about how healthy eating doesn't have to always be about cost. And I'm a DO, so I was very interested in this mind body approach. And then as you go into it, right, as we see the current healthcare model, what I've seen, is that even the well-meaning doctors, the ones that want to have these conversations, are feeling pushed or pulled with time. And I always tell my community that, right? Like, in my heart of hearts, I believe every general pediatrician wants to talk to their families about healthy sleep, healthy nutrition, balanced education around that. What can we do here? Because that's why I went into it. And now the system in general, and also, to be quite fair, the politicization of all of this, right? The doctors are not to be trusted, and it doesn't feel good to be in that situation. It has been so hard to be a pediatrician right now. And I'm not asking for, like, oh, Dr. Mona, poor pediatricians. It's just a reality that, like, me and my colleagues are seeing that sort of reality of, hey, we want to do this good work. This good work is being harder to do because of insurances cutting our times with patients. And so, like you said, connecting and finding is the gem. And then finding the other resources. I created this platform to be that resource, right? That
Mhm.
I tell my colleagues, I'm like, hey, if you don't have time, tell me what you want me to create a video on. And I promise you, I will keep it balanced. I will provide the evidence, and you can just direct them to me. Like, I'm trying to be that sort of specialist, right? That social media specialist
Yeah.
that can help that. But it is so hard.
That it is really hard. Time is getting shorter in
Mhm.
terms of the time you have to be with the patient. And some of the questions that patients come in with weren't ever questions before, because there's been built into the system this sense of you should not trust anyone who says that they are an expert, because what makes them an expert, you know? Um, well, what should make them an expert is that they've had the training and understand the science to be able to provide that advice. But there's been an undermining of that whole idea that there actually is someone who may know more about a topic than you, that can help inform what it is that you want to do. And that's really challenging. The social media. When I left CDC and I went to ABC News, I was there as their medical editor for about 8 years. Twitter was really taking off,
Mm.
and I started a Twitter chat every week, and we would cover a topic. I would bring in experts around that topic. We would get Twitter influencers on to help amplify and magnify. And I thought, wow, we are really forward leaning on this. The landscape is so totally different from what it was at that time, and it is, I think, critical that we identify social media influencers, bloggers who are evidence based, who people can then look to and say, hey, this is actually someone who is listening, who is taking my questions seriously, who is treating me with respect, and is approaching with humility. I would say that at least half of what I learned about nutrition as a medical student and a pediatric resident um, is no longer the recommendations that we make for children, for
Yeah.
babies, for young children, for because the science has progressed. And so it's so important that those of us in the medical community, the public health community, when we make a recommendation, we're clear about what it is we know, what it is we think we know, and what it is that is our best judgment. And let people know that as we learn more, some of the things that we're recommending now are going to change. And that's a good thing. It means science is advancing. It doesn't mean we're waffling.
Yeah.
It doesn't mean we don't know what we're talking about. It's like that's how science works. There's something that you think is the right thing. You do this research, you do the studies to find out, and then you can be more firm in your judgment. But the world as we know it now, whenever there's a change in a recommendation, there are people who are waiting to throw you under the bus
Yeah.
rather than to say, wow, the system is working the way it should.
Mm. I feel that. And, I think a lot about the introduction of allergenic foods, right? Like for a long time, delay, delay, delay. And then obviously through the research and understanding, which makes sense. It's practicing medicine for a reason, right? We learn as we go, and the human body is so complex. So of course we're going to see changes and recommendations changes. That's why I love being a doctor so much, right? Like there's never a dull moment in the work I do, but like that recommendation, right? Delay. And now we all know, and it should be the case that early introduction is, I think, a good example. And it could be that, well, you made a mistake about that. What I hear is what you just said is that, well, you all were wrong about this. And so how can we trust you that you're not wrong about this? And I think from a clinician standpoint, I always try to not use absolute terms. Whenever I'm talking about things like vaccines or anything, I'm saying, hey, this is what we know. The benefits outweigh the risk versus 100% safe, even though I know that they're great. The benefits greatly outweigh the risks because that creates this understanding that, yes, I want my kid to get this because the benefits are there. Are there risks to anything that we do? 100%. But I want the best for my child, just like my doctor does. And I think that is a very valid point.
Yeah. Yeah. I think that's, it's so important. And it's not just like the disclaimer that's at the bottom of the TV ad for every drug.
Yeah.
It's a real honest relationship where this is what we know now. I think your example of allergens, when you holding, when I first learned, it's like, no eggs, no orange juice, no nuts, no nothing till 1 year. And it's like, wow, we've learned a lot since that. And we always started with rice cereal as the first food because it was so easily digested. And it's like, yeah, it's converted immediately to sugar.
Yeah.
And it's like, oh, so the humility piece is there. And I really think that it's developing that relationship, which is why I am so concerned, and that the foundation we're so concerned with the increasing number of people who are not given the opportunity to develop a relationship with a trusted health provider.
And I think that leads me to the next question, which, of course, a lot of the work that's being done is advocacy, affordability, accessibility, not only in healthcare, but, for example, food access. So what's kind of been happening with policies that affect affordable food access, like with SNAP and WIC?
Yeah. Yeah. I mean, I wouldn't say it's a worst case scenario, but it sure is pretty bad.
Mm-hmm.
We know that SNAP is incredibly effective at addressing hunger in America. When SNAP was expanded and access to SNAP was expanded during COVID, we saw a dramatic drop in hunger among children in our country and adults. What SNAP isn't, though, is a great nutrition program.
Mm-hmm.
It's designed to combat hunger. WIC, on the other hand, has been shown to be a terrific nutrition program. And children who are enrolled at WIC at birth, there are incredible health benefits over the course of their life. What we're seeing now is that more and more barriers are being put up in terms of people getting access to those services that they are entitled to. The administration talks all the time about waste, fraud, and abuse.
Mm-hmm.
Well, it's a mantra, but it's not the reality. There's very little waste, fraud, and abuse in these programs. And by putting in these requirements for recertification so frequently, what you see is people who qualify for these programs, who are entitled, aren't able to meet the frequent documentation requirements. And so they lose those services. And if you're losing SNAP, you're more likely to be hungry. If you're not getting into WIC, you're more likely to have a gap in terms of your nutrition. So that's one big area. The area where I think that there's real opportunity for parents to do a lot of advocacy is around the school lunch program.
Mm.
Because another thing we saw during COVID, when more and more states went to universal school lunches, is that children's nutrition and health improved. Their ability to function in class improved. And what you did in those programs was you removed some of the stigma around having to certify that your income is at a certain level in order to get that school lunch. You were able to ensure that every child in that school had access to a school lunch. What needs to happen, though, the school lunch program is administered through the Department of Agriculture. And their approach to the school lunch program is more one of supporting big agriculture in America
Mhm.
than it is about promoting the health of children in America. And so, we see more and more schools that don't have a kitchen, that can't prepare a meal, that have to give you this packaged meal that is more likely to be highly processed foods. We're seeing the administration cutting back on and not expanding programs that were bringing real food from farms into schools so that kids were getting more fruits, more vegetables, more whole grains, getting exposed to those at an earlier age. We know from pediatrics that I think a child has to try something about 8 times before they develop the taste for it.
Yeah.
That's a lot of times. And schools get very upset about food waste, and no one wants a lot of food waste. But some of that waste is kids trying something those first 7 times before it really sticks. And so if we can build into our school lunch program appropriate funding levels so that the meal can actually be one that is more identifiable food, fresh fruits and vegetables in there, then we're going to see an improvement in children's health. And parents, I think, are in a perfect position to advocate for that. Go in, if you're able to take the time to go to your cafeteria and see what the lunch is, then go to your school board and say, I want our kids to eat something that I would want to eat.
Yeah.
And get the cost of the meal up from about $1 to $4, and have it be something that's really there. For a lot of children in America, the healthiest meal that they get is their school lunch.
Yeah.
So let's make it something we can all be proud of, that really promotes the health of children, and the health that will. If you have a healthy child and who has healthy eating habits, that will follow them through the rest of their life.
I love what you said about parental advocacy. I think parents forget that, and I feel like there might be so many other layers to that, because I want to give the example that my son goes to a private school, and there were some meals there that I just wasn't thrilled with. Right? I was like, you know what? Like, can we have other options here? Not that I think, again, this is not a hierarchy of food. It's that, can we create something more balanced that has a protein, a vegetable, a carb, and it's something that is like, the nice, the my plate, like just have the combination. And they actually sent out a survey, and I was like, I'm on it. Like, I'm going to fill out this survey, give all the detailed. I actually did a screenshot of the my plate and said, hey, can we provide this? And they were able to change it. Now, that being said, my son goes to a private school. Do we see barriers with what you just said about the advocacy piece for public school systems because of resources or anything like that? And what can we do for those schools that may have pushed back to parents or say, well, that's not something we can do, to really encourage that those public school systems get those same opportunities to introduce these healthy meals?
Yeah. I think that there is real opportunity.
Yeah.
There's opportunity to get involved at the local level. Voting really matters. If you look at participation in like school board elections, it's incredibly low. So a group of parents who really care about an issue can have an influence and can get a seat on a school board, and those seats are really important. A lot of the issues around funding for schools is done at the state level, and once again, the voting for state representatives, state senators tends to be pretty pretty low in terms of participation. So
Yeah.
there's an opportunity there to to get your voice heard and to have it count.
So, a part of my platform is helping people understand that even if an issue doesn't apply to them, that they should care, because I believe in that, right? I know we as humans can't care about everything and that there's so much on our plate. But for someone listening who isn't feeling the pinch, maybe they have a school that gives amazing lunches, or they pack lunches, or they are not on SNAP or WIC. Why should we all care about food affordability for our communities?
Yeah. Yeah, I think there are different ways to think about that. We're in the year where we're celebrating the 250th anniversary of our nation, and if you think about the founding of our nation and the pursuit of life, liberty, pursuit of happiness, and what it takes to have a just society. One of the fundamental things that should be there is that people should be able to eat.
Yeah.
That we are the wealthiest nation on the planet. How can we accept that there are so many millions of people in America who don't know from day to day whether they're going to have they're going to have any meal, let alone a healthy meal?
Yeah.
And we have the ability as a nation to eliminate that problem. I think from a moral, ethical perspective, it's absolutely critical. From a stability of society perspective as well, if people can't, work 40 hours and earn enough money to put a decent meal on the table and a roof over their heads, then the society isn't working for them.
Yeah.
And why will someone want to participate in that society and support it? So there are all kinds of reasons. I fundamentally believe in opportunity and the importance of opportunity, and that everyone in America and around the world should have an opportunity to thrive, regardless of income or race or sexual orientation or geography, where they live. These things are fundamental in the world. And it's hard for me to imagine why someone wouldn't care about that.
I feel this so strongly because I speak so much on my platform about parenting, right? Like I talk about, okay, handling discipline and limits and tantrums and all this. But in the end, the things that you mentioned, right? The food education, access to food. And then I also put, access to health, like good education and healthcare, right? Those three things are the foundation of any society. And we both can agree to that, not only as pediatricians, but just as common sense, right? If our communities are not getting access to healthy food, good quality education, healthcare, these are the bedrocks of a healthy foundation. And I love what you mentioned about being able to provide and want to invest back in society, right?
Yeah.
Like that is so huge, right? If we actually want to breed this capitalism machine, and I bring that up, right? America is a very capitalist
Yeah.
society, for better or for worse. I have a lot of gripes with that. I understand why it may help in some ways, but in general, it seeps into all of these areas. And we are not allowing families to contribute or want to contribute when they are struggling, and the stress. And what does that do for what me and you both know? It doesn't make them available parents. And I'm not asking like you're there all day, every day, but like emotionally available when you're struggling with getting food on the table, or what is my kid going to eat? And that impacts everybody. Like I feel this so strongly too, Rich. Like I do feel honored and privileged to have the means that I do, and I've worked hard for that. But that doesn't mean the person who works 40 hours a week and is still struggling is not working hard enough, right? Like we need to be able to live a life where you can have a good job, a decent job, and have basic expenses met, which, to be honest, was the reality 30 years ago.
Yeah.
And now it's not. Like I think about my parents' generation, were like, yep, they worked 40 hours. They had a good life. They put food on the table. We were able to take low key vacations. Stress wasn't there. And me and you both know that stress is the number one killer of everything, right? It impacts everything we do. And I'm just worried about all these policies and everything that is just causing so much stress for families to just
Right.
meet their basic needs.
Yeah, I mean the number of people who have to work 2 and 3 jobs
Yeah,
to make ends meet, um, that makes it pretty hard to be the kind of parent that you want to be.
right.
Because, as you're saying, so much of parenting is being present, and if you're not able to be present because you're needing to work to make ends meet, you're gonna do that because you have to survive first off. So these are fundamental issues, in our society of who has the opportunity and who does not, whose children are allowed to dream and potentially see those dreams come true, and whose children are told, you don't have the room to dream. You
Yeah.
just have to get on with it.
Oh, I feel this. I am again so grateful for the work that y'all do. How are community advocates stepping in to protect families' access to nutrition and more broadly to strengthen the overall health and well-being of families? And I totally respect that there's so many layers to this, but let's talk
Yeah,
about some positive things that we're doing here.
yeah. I we're doing a lot.
Yeah.
I think that our vision is for a future where health is not a privilege but a right. And there's a lot you can unpack with that in terms of who is privileged in America to be able to lead a really healthy life, to have those things that they know that they need, and they're able to provide that, and who is not and why not. And so we work a lot to try and address the barriers that are there to health. In America, one of the biggest barriers is around structural racism. And so
Uh-huh.
we have a big focus on looking at how that plays out in various ways throughout society, and fighting back on that. I've been at the foundation for 9 years, and if you told me 9 years ago that we would be investing hundreds of millions of dollars in protecting our democracy and on building a democracy that works for everybody, I would have thought that you were crazy. What's the connection between democracy and health? We are seeing what that connection is. If people don't have the ability to influence their lives through a working democracy, then their lives will not be healthy.
Mhm.
We have invested a lot in ensuring people have access to ballot initiatives. And it's like, well, that's pretty wonky. Why are you doing that? Well, in many states, ballot initiatives have been used to raise the minimum wage, which means some people who were in poverty no longer are, and they can buy food and healthy food for their families. We've seen ballot initiatives be used to guarantee access to reproductive health care,
Yeah.
and abortion is part of that. That's been done through ballot initiatives. We've seen Medicaid expanded in many states because people in those states demanded it, even though their elected officials said, "Well, we don't want to do that because that was a Democrat thing." They're saying it's not a Democrat thing; it's a health thing, and we want it. We're seeing pushback on that. In your state of Florida, they changed the rules around ballot initiatives. So it
Yeah.
used to be that 50%, 50% plus one was enough to win a ballot initiative. Some states like Florida have raised it to like 60%,
Yep.
which is why reproductive justice failed in Florida. The
Yep. I
majority of
saw that.
people wanted it. So it's we're working in that space in a big way. Back in at the end of June, the Supreme Court ruled that anyone born in America is a citizen.
Yeah.
They supported birthright citizenship as written in the 14th Amendment. That was in the 14th Amendment as a way of addressing one of the horrors of slavery. And the administration said, no, we don't believe everyone born in America should. So one of our grantees, the ACLU, was the lead plaintiff on this, and they won because, fighting back wins. Over 200 of our grantees, our grantees last year were involved in over 200 lawsuits against the administration. They won 70% of them. And so these were things like the administration, when there was a government shutdown, wanted to stop SNAP payments, food to people,
Yeah.
and our grantees took them to court and got that overturned. So fighting back works. It works at the national level. It works at the state level. It works in communities. And so if there's an issue that people care about, don't feel that fighting back doesn't work. There's one of the things that authoritarians want to do is create a sense of helplessness, that there's nothing that you can do, that this is out of your control, and just get used to it. And what we're trying to do, and what our grantees are trying to do, is create a different story. And it's that fighting back works. Fighting back is the best way to counter changes in our society that take us in the wrong direction. And so advocate, fight back. Those issues you care about, do something about it. It's so good for your mental health as well, to not feel like, oh my God, there's so many things going on in the world, there's nothing I can do. It's just like, you can't do something about all of them. So pick one that matters to you, that you think is so important, and talk to other people and see what matters to them. Part of this is, I think, when you're at the local level in particular, finding a way to see the humanity in everyone around you. We are so polarized, so balkanized around issues, but the ability to talk to someone who you may not agree with everything on,
Yeah.
and look for those threads, those common areas, and you may find things that you can actually work on together.
I love that last message, and I think that's what's causing so much more divide, in that we feel, again, not only has there just been this huge polarization of what we started with, right? Like pro-vaccine, anti-vaccine, clean food, anti-clean, like it's like there's so much middle ground that I don't think we realize that most Americans are interested in. I think I've worked with y'all on a campaign on that, on understanding that most Americans want the same thing. It's the media, it's the social media, it's all the people saying that, no, we are against each other. When I don't think any family wants rising costs of groceries, rising costs of healthcare, rising costs of housing, and rising costs of childcare. I mean, all of this stuff is squeezing us in every different way, and even if you are with means, as I say, like that is still impacting you. And like I've always said, it impacts your community, which you said beautifully. Like, I want my kids to be able to go to a store, go to the park, and know that their peers, whether they have the same income bracket as us or not, are getting the same access to the things that they do in terms of the basic needs. And that reality really hurts in a place like Florida, knowing that there is such a case of the haves and have-nots, right?
Yeah.
Like, you either have, it's become so much more of a divide here. Like, and the pandemic has really blown that out, where it's like you either are very well to do, have the means, or then you are really struggling. Like, the loss of the middle class is really becoming a reality here. And to me, it's not fair. As someone who takes care of children, as someone who does have the means to provide, I still don't like it that my peers of my children do not have the means to survive. And that is just unfair. And going back to, all of this, like families feeling squeezed, the rising costs, all of that. What would it take to ensure every family has what they need to thrive, where they didn't have to choose between paying for groceries, covering rent, or picking up their medication? Do you feel it's policy, or do you feel it's something else we need to do?
I think a lot of it is policy.
Yeah.
I worked in government for 13 years, and I've seen the power of good government policies to create those opportunities, to fill in the gaps. And I think there's a myth that if you just work hard enough, you can get it done.
Yeah.
There are a lot of people who are working so incredibly hard, and they're falling further and further behind. And so, these programs, we need universal health care in America.
Mhm.
We need to have a situation where no one is going to become bankrupt because they become ill
Yeah.
and had to choose between paying for a drug and paying their mortgage or paying their rent. We can afford that as a nation. We need to agree that this is a nation in which no one should be hungry and no one should be without a house. These are things that we may disagree on how we get to those things, but I think fundamentally we need to agree that these are the objectives we're all working towards, and then let's debate it. Let's how we get to those things. I am a true believer in the power of government. I've seen over time what's happened when programs like Medicare were created. All of a sudden, we saw a dramatic drop in poverty among the elderly. It's like, wow, that's incredible. If you take healthcare, off the list of the major expenditures for someone as they're getting old, they're no longer as likely to be poor. It's like, why can't everyone experience something like that?
One thing that I've been watching, and I would like to be clear that I respect people have different opinions on, policies, politics. I have really enjoyed watching what Mamdani's doing in New York City, only because I just feel for the first time in my life, I'm seeing like a political figure really listening to the people and trying to figure out what to do. And I feel like we've sort of seen a reclaim of the political system. And, I saw a post that they're trying to create more grocery stores for food deserts. And this is something that they're trying to do through the city government, right? Like, hey, we're looking to create more New York City grocery stores. Like, let us know if you have an open space, we will create this for you. And I was just looking at all those, again, policies that me and you are talking about, right? Universal childcare, the grocery access, and people are in the comment section like, hey, we have a food desert in Bed-Stuy, we have this. And I say to myself, I know this can be done. And like you said, the way it gets done can be disagreed on, but I know I'm seeing it done in the largest city in the country. And it's really cool to see the policy. Again, I respect people's belief systems, but I have just been very intrigued. I don't live in New York anymore, but just watching what can be done when someone and a community is looking at the needs, like getting on the ground, like you said, right? The advocacy, listening. I think you mentioned about listening to people who disagree with you.
Yeah.
Like that is what this is all about. And I just think it's a beautiful thing that we're empowering families. What would be your final message to someone listening here in terms of, a lot of my listeners are parents, right? So the role they can play in their own communities and the power they already have to push for change when they feel like they don't. What would you say to those families that are like, I love all this, but I don't know where to do. I don't know what to do. I don't know where to start.
Yeah. The example that you give of Mamdani in New York City, I live in New York City, and what really excites me and gives me hope is that he's been able to pull young people into the political process.
Yes.
And for so long, I had this great concern that people, when people said, oh, why should I even vote? It doesn't really matter. He's been able to capture and captivate and inspire a new generation to say, we've got ideas too.
Yeah.
And we want to give our ideas a try. Maybe some of them won't work. But a lot of you old folks, your ideas didn't work either.
Right.
And so what I would say to every parent is the lesson from what you're calling out there is get engaged, don't give up, look for those people who are inspiring, who are lifting up ideas for what should be. Don't write them off as being overly idealistic. Mm-hmm. Give them a shot, because what you're going to find is that some of them go forward and greatly improve the lives of so many people in our country. And that benefits everybody in our country. We have a grantee. We have just one more point. We have a grantee in New Jersey, the New Jersey Institute for Social Justice. And they had a campaign to allow 16-year-olds in Newark to vote for school board elections.
Wow. Amazing.
And it passed.
Yes.
And so if you're 16 in Newark, you can vote for the school board. And, it's about the school board, but it's about so much more. It's about getting people when they're young invested in changing society for the better, and through their own voice and their own activism. Parents can do the same thing. We're seeing that with the Maha movement. We're seeing people taking control, and what I get worried when I see movements being co-opted by folks who are spreading false information. But the idea that taking control and taking action is something that you could do and you should do is really important.
I agree. And I think it's so inspiring to just watch and see. I do the same, right? When I'm like, oh, how can I get involved or what can I do? I'm just looking for all the helpers, all the people, like we mentioned, that like sort of are doing the thing and maybe we may not have the capacity to do it at the full level, but at least it inspires us that change is possible. And I think this is so beautiful, Dr. Rich. I have really enjoyed this conversation. Where can people go to stay connected on not only all the work that, Robert Wood Johnson Foundation is or any of the, grants and activities that you all are involved in?
Yeah, I mean, you can come to our website, rwjf.org. You'll see there what it is we focus on. You'll get to read about some of our incredible grantees. I think we've got about 1,000 across the country at any one time. But it's, we are pushing back, and we are pushing back hard, and we are lifting up a vision that I am really excited about, and I'm optimistic that we are making progress. Our grantees, people in communities, are changing things for the better.
And for anyone listening, I think you may know, but I do some work with the Robert Wood Johnson Foundation in terms of listening in on the advocacy projects that they're doing. And I don't just talk to anybody. For me, the work that they're doing is truly changing the world, changing our country. And I am just so grateful Dr. Rich could join us today. And I do not think this is going to be the last time you are on my show, Dr. Rich, because this was so enlightening. And thank you again for joining us today.
Thanks so much. I really enjoyed the conversation.
For everyone tuning in, you have a few action items that will not take too much time off your hands. You are going to hit that thumbs up sign because I know you love this conversation. You're going to comment on something that you took home or an action that you are going to do based on this conversation that inspired you. And you are going to share it because that is how we can continue to get these messages out there. And make sure again that you're subscribed to the channel. I cannot wait to talk to another guest next time on the show, but also to have Dr. Rich back on to see the incredible work that the Robert Wood Johnson Foundation is doing to change access in America. Thank you again for joining us and have a great rest of your day.